Thank you for being here. This short video covers stroke risk and simple steps you can take to support your brain health. Whether you're part of Nourish or just learning more, we're glad you're taking this step. Enjoy this short video, and at the end, see how to learn more and get involved with research and the Center for Healthcare Innovation.
You know, when you were going through the risk factors, and the first thing I keep thinking about is, well, how are they different in different groups? Okay. And the good news is there's a lot of research in this. For example, men and women. Are there differences in outcomes between men and women? And then are there differences between different, what we say, populations, ethnic and racial populations? So let's talk about men and women. What do we know about stroke outcomes when it comes to men and women?
So women, unfortunately, have worse stroke outcomes than men. And despite most of their lives, women are protected by estrogen. So the risk of stroke is actually lower in women when they're younger, but women tend to outlive men. And as they go through menopause, that protective effect of estrogen dwindles and is no longer there. And then if they're living into their 70s, 80s, 90s, their risk of having a stroke is going to be higher. And so what ends up happening is when you think of the total number of people who have strokes, actually there's more women who have strokes and more women who survive their strokes. And if you take two individuals who are similar, a man and a woman, and you look at them after they've had their stroke and they try to go back home, they try to recover and get back into their daily lives, women do worse. And so there's a lot of speculation, and we don't fully understand it. But if you think about a lot of families, sometimes it's the wife or the mom who's kind of organizing things, taking care of other people.
Caregiving.
And so what happens to the caregiver when the caregiver needs care? And so coming home from a stroke and maybe not having somebody who's really looking after you in the same way that you would be able to do for your family members can be a real barrier. And so that's one of the things that we think about. Women are also less likely to receive acute stroke therapy. So to get to the hospital in time, to get clot busting drugs or the surgeries where they pull out the clot from the brain. And, those reasons are a little bit poorly understood. I don't know if it's don't worry about me. I'll just sleep it off, or I'll wait to come in. Don't trouble yourselves. I don't want, an ambulance. That's really a lot for me. Don't do that. And so for a variety of reasons, they may just not be getting to the hospital rapidly enough to qualify for treatment is another concern.
No, I was just saying, like, when we talk about this, differences between men and women, me being a cognitive neurologist and in the field with Alzheimer's and dementia, we see the same thing. Alzheimer's is a woman's disease. Many people still don't know that. Same things are happening with Alzheimer's. Outcomes are different for dementia with women. Women also don't come into the offices for memory assessments and concerns. So we see a lot of similarities here between the two. And we also know that cardiovascular disease and stroke can set you up for a cognitive decline and dementia later on. So I think this is a really important point you bring up.
Thank you for being part of this conversation. Through the NOURISH Study at Rush University Medical Center and our partnership with the Center for Healthcare Innovation, we're exploring how nutrition and food access impact brain health and stroke outcomes. Learn more about the Connecting the Dots series at chisight.org. If you missed a study visit, that's okay. We're here to help. If you have questions, want to reschedule, or simply want to learn more about our work, please reach out to our field team using the contact information on your screen. We'd love to hear from you.